My name is Michael. I'm a registered massage therapist working at TUINA downtown location. I'm going to show you how to treat the frozen shoulder. Frozen shoulder is the conditions that affect your shoulder joints. It involves pain and stiffness. Shoulder joint is made up of 3 bones. One is the scapula, humerus, and clavicles. There is the other tissues surrounding these joints that hold everything together. We call the shoulder capsule. To start my treatment, I will let my clients do the prone position first. So first, I will warm up the muscles. So latissimus dorsi, teres major and minor, rhomboid, supraspinatus, inferior spinatus, and the trapezius, deltoid, and the triceps. After warm up these muscles, I will do medial rotate this arm slowly and gently. This way 3 times and another way 3 times. So after that, I will doing elbow compression and moving my elbow up. When I close to the superior angle of scapula, normally I can find some trigger point over here because this point also attachment of levator scapula. So how to treat the trigger point? Normally we do the ischemic compression to release the trigger point. So after release the trigger point, I will do some squeeze on the upper trapezius and also deltoid. Do some friction, the tendon of the supraspinatus. So I will put the arm back and use my leg to support this arm. So in this position, I can do elbow kneading on the teres major, minor, even the triceps. So in this position, it's easily to palpate subscapularis. So I'm doing some kneading on the subscapularis. So if I find some trigger points, I will do ischemic compression again to release the trigger points. After that, I will hold medial border of scapula and to pull out. This is to stretch the rhomboid muscles. So after all of this, I will do a little up the arm. So for this action, I can stretch the muscles over here, also do some joint mobilization again. Okay, in this position, I'm going to do fascia technique. This technique can break down fascia adhesion. After this, I will do abduction of the arm. For abductor arm, I need to be careful because some patients cannot do fully abduct the arm due to the pain. Slowly, gently. So in this position, I can work on the pec major. So do some palm compression over here. And later, I can still continue to work on subscapularis over here. And another muscles, pec minor, which is another very important muscle to be treated for frozen shoulder. So after this, I'm going to try to move a little bit the arm. It's also joint play. So I can do posterior gliding of joint and the inferior gliding joint, even the lateral gliding of joint. Now I'm doing the finger kneading on supraspinatus muscles. So all the way to the shoulder. So here I can palpate the tendon of the supraspinatus. I will do some friction on this tendon. Try to break down the adhesion of this tendon and just do some deltoid kneading, go tricep kneading, and the forearm. After that, I will slowly and gently to pull the arm all the way to here to stretch the muscles over there. If I want to for further stretching, I will ask clients to turn the head away and do a little more. So now clients will feel fully stretching the muscle over here and even do some joint mobilization of the shoulder joint. I will hold 15 to 30 seconds. So after this, I put the arm back, do some upper arch for the muscles.